As COVID-19 cases continue to rise, we all need to take steps to stay safe. In today's To Your Well-Being, we are breaking down places and behaviors that increase your risk for catching coronavirus. The Chief Medical Officer for Moses H. Cone Memorial Hospital is here with us. The first question is, where are we more likely to get infected or exposed to coronavirus? Sir, can you hear me?
Yes. I'm sorry. This is Jay Wyatt. How are you?
Great, thank you for joining us. We appreciate it. A lot of people are wanting to know, where do they need to avoid so they don't catch coronavirus these days?
Any place where you're gathered on the inside, certainly in rooms that are more crowded than others, where there's a risk that people will not be wearing masks, where there are more than 10 people gathered, that certainly increases your risk of getting COVID. Also, gatherings outside where the groups are larger, your risk is increased. Certainly, if there are people that are not wearing masks, it's very difficult in the early stages of COVID infection to know if you are infected. So asymptomatic carriers are out there, and being exposed without you wearing a mask, without them wearing a mask, certainly increases your risk.
You mentioned even outside there. What's a group size that you should avoid even outside?
Generally, we're recommending groups of greater than 10 should be avoided, even outdoors, especially if these are not groups that have been together for a while, say families that have been living together for a while. Even family members that have not been living with you should not be allowed to be within those groups, coming from environments that you just don't know where they may have been exposed.
Health experts and state leaders have told us to avoid risky behavior. What's considered risky?
I think risky behavior includes things like going to bars where people tend to get a little bit loose in their precautions, and the contact is much closer. There's generally no restrictions on what they're doing in terms of masking sometimes. So I think that is truly risky behavior. I also think that going to gyms right now could be fairly risky, where you tend to aerosolize a little bit more because of the heavy work intensity. A lot of people are not able to wear masks during exercising, so that may increase your risk. Any gathering, parties, weddings, funerals, anything like that tend to increase your risk. Even going to church, even on a limited basis, can be risky.
A lot of people I know are saying, hey, I still want to go out and support these local businesses, these restaurants, the bars, the gym. Is there a way to do it safely?
I think if they're set up to keep you socially distanced in an appropriate manner, you wear masks going in and out of the facility, the people working there are wearing masks, I think that does minimize your risk. I can't say that it eliminates the risk completely, but it certainly minimizes it.
Yeah, the only thing to really eliminate the risk is to stay at home and never leave, right?
Pretty much, if you put yourself in a bubble, you might be able to minimize the risk or eliminate it, but I'm not even sure of that anymore.
So are there places that are considered risky for people who are just at a higher risk, or is this for everyone out there?
This is for everyone out there. The people who are at higher risk are at higher risk of getting very sick when they contract the disease. If you're somewhat immunocompromised, you may be at higher risk of getting the disease, but the risk is mainly in being severely affected by COVID.
What's the number one risky behavior you're seeing that has actually landed people in your treatment?
It's really kind of hard to say because it's hard to get a very clear story from everyone about what they've been doing. But it seems as though small gatherings, parties, family get-togethers, things like that have been increasing the risk somewhat.
Uh-oh, that sounds like maybe the Thanksgiving holiday might be considered risky. Some of our viewers wanted to know, was that a risk if we celebrated with family and friends?
So I do think that there's some significant risk from the Thanksgiving holidays. Even if people were diligent enough to go out and get tested prior to going out being with their family members, you have to remember that testing alone does not completely eliminate the possibility that you could be a carrier at some point, and it may have been at that threshold where you just were not able to trigger a positive test. So I think there's going to be some fallout from the Thanksgiving holidays in terms of the number of cases that we started to see. And we haven't really started to see that yet, but I wouldn't be surprised if that starts to occur.
Okay, you mentioned you may not be at that threshold to trigger a positive test. So we had Thursday, Friday, Saturday, Sunday. We're in Monday. If you get tested now, would you be at that threshold?
It sort of depends. If you were, exposed on Thursday, Friday, or Saturday. If you were exposed on Sunday, even in an environment that you were not aware of, certainly you may not be. Certainly people who have become symptomatic from something should probably be tested. Again, there's no guarantee that a negative test is going to necessarily identify all the people who will potentially be a carrier.
Okay, I know there's some people out there watching on the fence about whether or not they should go get tested. What would you tell them?
So I think if you have had a definite exposure to someone that you know either turned positive or was symptomatic and turned positive during this holiday season or otherwise, you should certainly go get tested if you become symptomatic, or wait 3 to 5 days before you go get tested if you're asymptomatic.
And what is the importance of getting tested? Why do we need to do this?
The importance is so that you don't expose other people if you happen to be positive. I actually had a good friend who, based on exposure from some contact in his family, went out to get tested and turned out that he was positive. And because of that, or even before he got his results back, he decided not to come and play golf with a group of friends because of the risk. And I think that's being very responsible. And it turned out that he did turn out positive.
It's important to know too that if you have any symptoms while you're getting tested and waiting for them to come back, you should quarantine yourself, correct?
Absolutely.
What does that look like? Should you separate yourself from your family and your house, or just not be around other households?
If you are within the household, so you can quarantine yourself within the house. That means you get sort of room service and, wear a mask all the time, and everyone else is wearing masks, and you're cleaning incessantly and washing your hands all the time, and just making sure that everyone is staying appropriately spaced apart.
Okay, we know coronavirus is so confusing and there's still so many questions out there that you have. Now is your chance to ask the doctor and get an answer. You can text us your questions to 336-379-5775. We'll be right back.